Okay, welcome back to my channel. Welcome back. Please like, share, and subscribe, guys. We finally got this camera to work the way I wanted to. So, welcome back to my channel, guys. This is your PTA coach. Sorry, we had minor technical difficulties, but we got that all squared away. So, we're going to be covering some PTA questions. A lot of us out there have our exams coming up. Sorry, guys, I'm adjusting all my equipments here. We have exams coming up very soon, and we need to prep for that. Okay. And real quick, let me just read right here. For a lot of you that plan on taking the exam for July the 8th and the 9th, okay, the deadline to apply for the exam is June the 3rd. Okay. And also for a lot of you who plan on taking the exam October the 6th and the 7th, the deadline to apply is for the exam is September the 1st. Okay. So make sure you follow up with that and make sure you register for the exam so you can take the exam. So on this platform, we share a lot of information to help a lot of us out there succeed in the state board exam. I am a licensed physical therapist assistant in the state of Texas. Guys, I've been going at this for a long time as far as being a physical therapist assistant and just in general, just general knowledge, my experiences. I've worked in a home health care setting. I've worked in hospitals. I've worked in skilled nursing facilities. And so just I have a lot to share with a lot of us to help you prep for the exam. So today I have some practice questions that we're going to go over. And so I need to share my screen. Give me 1 second, guys. Let's see here. I will be sharing my screen. Let's see here. Give me 1 second. Let's see what I want to share. 1 second, guys. Okay, I think I have it there. I'm going to share this window. And let's see what we have here. Boom, there it is. Okay. So guys, give me 1 second. I'm going to be multitasking as we go. I will be. So welcome back to my channel. Like, share, and subscribe. Like, share, and subscribe. Guys, give me 1 second. Let me pull some stuff up here. I just want to make sure that you guys can see everything and everything is going just as planned. I'm not talking to myself, guys. I'm talking to myself and all of you. Okay. Give me 1 second. All right. So there it is. Good, good, good. That's what I want to see. That is exactly what I want to see. All right. So if you checked out some of my videos when I've gone over questions, I've told us a lot of things as far as this exam. There are certain strategies that work, right? Why do I say this? I mean, I've been through the exam, I passed the exam, obviously, and I got my state license. Okay. And so when we go through these practice questions, even at your spare time in your private moment, when you go through these practice questions, learn to pick out key words. Okay. It could get a little tricky, but we can do this. So I think I've kind of shared this before, but let's just go over this real quick. Okay. First question, a physical therapist assistant observed a patient complete hip abduction and adduction exercises while in a standing position. Okay. Which axis of movement is utilized with these motions? Now, this, of course, is under the topic of musculoskeletal. Okay. And I want you guys to check that out. I'm not just going to give away answers. It's part of our studying and learning. Okay. Quite honestly, it's part of our studying and our learning. And so, and it's not really a teaching moment, right? Because I've told you guys a lot of times on my channel, I don't go from scratch like teaching everything that you need to know because, I mean, you've gone through school, right? You've gone through the schooling phase and you've gone through the skill comps in your school and you've gone through the tutoring. Okay, you've done all that. So now is actually the time for you to review. So a lot of things that I talk about, I'm not going to start from scratch. I mean, I will give you little overall high level overview of the topic. But when you start to study and also come to my workshops, we dive deeper, right? So from this question, of course, we know that we talk about axis and planes of the body, right? Axis and planes of the body. Of course, we have the frontal, We have the vertical, which is also the same thing as longitudinal, if I can get the word out right. Sorry, guys, it's Monday morning. Okay, and we also have the transverse, right? When it comes to axis, what do we have? We have anterior, posterior, we have the medial, lateral, okay, and so on and so forth. And once again, I'm not going to go into detail of those things. So when you look at this question, a few things key things I want to highlight here, okay? A few things I want to highlight here. So let's look at this. The patient is doing hip abduction and adduction. Okay, let's just highlight that for a quick second. Okay, which axis? Guys, don't get tripped up on the exam. Okay, it's not talking about the planes, it's talking about the axis. Okay, so which one would it be? Which one would it be based on these options? Is it frontal? Is it vertical? Is it anterior, posterior? Is it longitudinal? Now, there's no frontal axis, right? I just talked about the planes of the body. Frontal is a plane. Anterior, posterior is an axis. So one thing you notice real quick, and I guess I'll just give it away, right? Option A, option B, and option D, those are all planes. It's not an axis. Now, for those of you who want to go read up on this, it's in the PTA book. Give me 1 second, guys. I'm going to pull up that book real quick. Give me 1 second. Let me get the book. For those of you studying, I know I always talk about the book. You might not be using books. You might be using apps or anything online for your studying. But I always tend to refer to this guy right here, right? As a guide. You guys might be using a different edition, but the concept and the topics are all the same, guys. It's not going to change from book to book. And if you find any kind of disparity in what you're studying and what I'm talking about, let me know, okay? Let me know, guys. But this is pretty much what I'm talking about is the first, it's pretty much on the first page right here. Chapter 4, Musculoskeletal System. Yours might be a different chapter, but it's right here. Down here, they talk about the planes, okay? And like I told you guys earlier, there's a frontal, also known as a coronal. There's a sagittal, and there's a transverse, okay? So I want you guys to, at your spare time, check this out and read through that to get the information that you need, okay? All right, let's hop over to the next question quickly, guys. It says here, in home health, a physical therapist assistant treats a patient following total knee arthroplasty. Which of the following physical therapy goals would be the most essential to avoid long-term complications? Okay, so let's pick out the key words here, okay? Total knee arthroplasty. Let's just highlight that real quick. You might want to go review on that, guys. There's so many ways that a question can be asked on certain topics. Or questions can be asked on a topic, okay? Let's see here. So yeah, most essential, avoid long-term complications. So if a patient just had a surgery, right? And you're treating that patient for a total knee arthroplasty, okay, what will be the goals, most essential to avoid long-term complications? Is it improve strength? Is it prevent deep vein thrombosis? Is it improve range of motion? Is it decrease inflammation? Now, see, the funny thing about this, guys, is that all these questions, all these answers rather seem correct, right? They seem correct. But what is the question asking for? Most essential, right? Most essential. And another thing I want to share with you guys real quick is this. When you get a question, either practice question or the actual exam, okay, don't try to add more information than what is provided. A lot of us, okay, because it's talking about this patient had a surgery and you're treating them, we're thinking, okay, they're immobilized, they're probably laying in bed for a couple of days, they're in a hospital or they're at home and we want to prevent DVT, right? But the question doesn't say anything about that. It just says in home health, right? So the patient is in their home. A physical therapist assistant treats a patient following total knee arthroplasty. So just go with what's given in the question. Don't try to add more information, because I feel like a lot of times when we try to add more information, we miss it. Okay. So obviously it's not prevent deep vein thrombosis. Okay. Now look at option D, decrease inflammation. Now, whenever a patient has a surgery, or in this case, a total knee arthroplasty, right? Part of the healing process is there's going to be a wound, right? Because the patient reads not the patient, but the body reads that as a wound. So there will be inflammation, right? So would decreased inflammation be a long-term, most essential to avoid long-term complications? Not necessarily, okay? So once again, guys, when you come to the workshop, we go into details about these things, okay? So I want you guys to read this, figure out the question. You can also send me a message, guys. Send me a message on here, or you can send a message to my email. It's my last name, aka LUSO, the number 40 at gmail.com. All right, let's move on quickly, guys, because I have to go. In physical therapy, a child is seen after being diagnosed with right thoracic scoliotic curve. Which of the following clinical features would be most likely given the patient's diagnosis? Now, like I told you guys earlier, right? With all these topics, there's more than one way a question can be asked, okay? What's the key thing when it comes to scoliosis, guys? And we'll round up with this question right here. With scoliosis, right, there's going to be shoulder asymmetry, okay? There's going to be leg length discrepancy, right? And many other things. So going back to this, okay? What's the correct answer? Is it going to be left rib hump with the forward bend test? Is it going to be excessive anterior tilt of the pelvis? Is it going to be increased elevation of the right shoulder? Is it going to be increased space between the right arm and trunk? Okay. Which one would it be? So I want you guys to go and review that, and many other things, right? Once again, a lot of the answers, guys, that's the thing, is a lot of the answers, like in this case, all these answers seem right, but you want to go back and review about scoliosis. How does it present? Okay. How does it present, and what do you need to look out for with scoliosis? And number 4, real quick, very fast, guys. A physical therapist assistant elongates a patient's long head of the tricep brachii as part of a muscle length assessment of the elbow. Which position of the upper extremity would be the most effective for achieving the stated objective? Now, guys, this seems like a lot of stuff coming at you all at once, right? And I've shared with you guys in the past, what is this question actually asking for? It's pretty much asking us, how do you stretch the tricep brachii? Okay. How do you stretch it? Now, in physical therapist assistant school, they teach us this, right? This is the way I understood it, guys. When you're trying to stretch a muscle, okay, you perform the opposite action of the muscle. What does the tricep do? It does elbow extension, right? Elbow extension. Guys, if anything I'm saying here is not correct or you're not understanding, send me a message, okay? Anything that I say here that is not accurate or is not really adding up to what you know, send me a message, okay? But just remember this. To stretch a muscle, you always perform the opposite action of that muscle. So with that information, okay, I want you to look at these options and tell me which one is it, okay? How would you stretch the tricep brachii, okay? All right, guys, I have to stop at this point. Hopefully tomorrow I want to do the same. Come back and we're going to go through some more questions. See, I have questions here for us to cover, okay? So make sure you check this out. Subscribe to my channel. We do have workshops that we host. Okay, if you want more information, send an email to my last name. It's AKALUSO, the number 40 at gmail.com. That's AKALUSO, the number 40 at gmail.com. All right, let me put that information here, and we're going to round up in a second, okay? For the workshop and consultation, because I know a lot of you want to talk to me, which is fine. Just send me an email, okay? Please email. It's my last name, aka LUSO, the number 40 at gmail.com. Okay, and so I've also shared a lot of information on my videos. I talk about the fact that pretty much for us to pass this exam, guys, there's a lot of things that need to be in place, right? 3 out of the 5 topics in the exam are heavy, loaded with a lot of questions. So it's almost impossible to pass the exam if we don't hit these 3 main areas. You guys see this right here, the musculoskeletal, very important, okay? Cardiopulmonary, very, very important, okay? And the neuro, very, very important, okay? So the musculoskeletal system, the neuromuscular system, and cardiovascular system almost make up for 60% of the exam, okay? 60% of the exam covers all these things, okay? So it's almost impossible to pass the exam if we don't hit these 3 main areas. Now, I'm not saying that the other 2 areas, other systems and non-systems are not important, guys, but the exam seems to favor a lot of questions in these 3 main areas. Once again, it's 4 hours, 180 hot questions, right? 180 very hot questions. Now, I believe 30 of the questions or so are test questions, but we don't know which ones are the test questions. So when we go into the exam, we just have to go in there, stand on business, like I tell all of you, take the exam and pass this exam. It's possible. It's possible to pass, guys. I did, right? And so I'm sharing all this information with you to prep you for those moments when you have to go in there and get this taken care of, okay? All right, guys, so I have to stop at this time. I have to move on to go do other things. But please like, share, and subscribe to my channel. Like, share, and subscribe. Make sure you hit the notification button so you know exactly when I come on. And I appreciate all of you at this time for joining. And I look forward to talking to all of you tomorrow. But until then, have a wonderful day. Stay blessed. Bye-bye.